if you use my iPhone because I don't have
That's right. Yeah. Good morning, everybody. Pursuant to Standing Order 1082, the motion adopted by the committee on Tuesday, May the 4th, 2017, the committee is commencing its study on advancing inclusion and quality of life for Canadian seniors. First, before we get going, I'd like to welcome Member of Parliament Rachel Blaney to our committee. Will be joining us for at least this study. So welcome aboard. And Karen, are you just a stand-in? Or are you fantastic? Excellent, excellent. All right. We're going to get right into witnesses, and first and I would think most important with regard to this study is the reason we are here. Member of Parliament Mark Surrey. The 10 minutes? Yes, the next 10 minutes are all yours, sir. Welcome aboard.
Thank you, Mr. Chair, and good morning, all the HUMA committee members. Thank you so much for all the work that you do. So thank you for inviting me today to share my thoughts to the committee. I'd like to begin by sharing some wisdom that was related to me by Senator Sharon Carstairs. There are as many ways to age as there are Canadians who are aging. And the seniors that are defined on how they live and not by their age. So Canadians have recently heard alarming statistics with regards to our aging demographics. In addition, this motion sets the stage for all levels of government to work towards servicing our seniors population across Canada. Time for action is today, and planning for the future is where M106. And I want to thank for the approval of the House of Commons on May 17th of this motion. And this sets the wheel in motion to formalize and develop a national senior strategy. Comme vous le savez peut-être, ma motion...
As you may know, my motion M106 also engages a dialogue between the National Seniors Council, and this study will inform the newly reformed National Seniors Council about how best to develop and implement a national senior strategy that will bring real positive change to the quality of life and well-being of seniors, as well as caregivers.
Their work in the All-Party Seniors Caucus, Mark Wara, and NDP Alistair McGregor for their work relating to seniors. This is a working that goes across party lines to discuss ways to improve the quality of life for seniors. Here's why I decided to focus my private member's business on developing a national senior strategy. When I look at the motion itself and l'inspiration que j'ai reçue pour ma motion.
The inspiration I got for my motion, there are two main reasons. First of all, my family, and secondly, seniors who are on a fixed income and who mainly live in poverty. I heard from people throughout my riding in Nickel Belt and from across the country. My father, who was an MP himself, starting in 1968, is the eldest of 16 siblings, and my mother is the oldest of 15 siblings, two big French Catholic families in rural Northern Ontario with 60 aunts and uncles and 100 first cousins. So looking at the issues of our family members who are caregivers as well, this is a huge concern that I have, that families help other family members. We need to be there for our families, but I also realize that not all Canadians have a large family they can rely on to support as well as their family's age.
Rise in the number of seniors caring for seniors. This includes seniors caring for their senior spouses, friends, and even parents that are aging in the stage of life. Often these seniors are on fixed income or have certain mental or physical challenges of their own, making it difficult to care for their loved ones and even themselves. It's been an honor to discuss across my riding and across many of the MPs, and also talking with staff and seniors at assisted living centers like Au Château, Home for the Aged in Sturgeon Falls, St. Gabriel Villa in Chelmsford, St. Elizabeth Center in Valley East, St. Joseph Health Center, and finally a home in the greater city of Sudbury and throughout the riding of Nickelbelt. Plusieurs organisations aussi communautaires.
Many community organizations like the Club d'Âge d'Or of River Valley, Field Werner, Sturgeon Falls Living, Azilda, and EUS, and also the Golden Age clubs.
On Eping-Levac. Furthermore, my experience as Northern Ontario Caucus Chair and Vice Chair of the Rural Caucus and a member of the Algonquin of Ontario First Nations community, also I continue to learn and understand the needs and challenges faced by seniors living in rural areas and the challenges and the needs of Indigenous communities across Canada. What I've heard are stories of resourcefulness for seniors who want to remain independent and live in their home for as long as possible, but are unable to afford the cost of making their home accessible and friendlier to their needs. I've heard stories of caregivers who work tirelessly to support their loved ones, but at a cost to their income, sometimes their mental and physical well-being, and of seniors who want to be happy, healthier, and active in their community, but are having a hard time making ends meet. Above all, stories of people who love their families and they want to ensure that they live long and happy and healthy lives, and that it motivates me to focus my private member's business on developing a national senior strategy. I completely agree that one of the most important topics this committee can study with regards to improving quality of life for seniors is improving affordable and accessible housing. D'après l'Association médicale canadienne, prendre soin des personnes âgées dans
According to the Canadian Medical Association, caring for seniors at home and in their community as opposed to in hospitals is one of the most cost-effective ways that Canada's healthcare systems can meet the needs of seniors who are not fully experiencing dementia or are not critically ill.
Canadian Medical Association, Dr. Granger Avery, who has been actively campaigning MPs and the House of Commons for the past, and Canadians for the past 3-4 years. I would encourage all committee members and Canadians to visit demandaplan.ca, exigeonsunplan.ca, who has already signed up 50,000 Canadians. Thank you, Dr. Avery, for all the work that the association is doing and your work on behalf of seniors across Canada. Encourage treating seniors in their homes and enabling seniors to live in the communities as long as possible is something that 9 out of 10 seniors have said is critically important to them. According to the CMA study, most home care in Canada is provided informally by unpaid family, friends, and neighbors. In fact, the Conference Board of Canada reported in 2007 estimated that unpaid caregivers provide 10 times more hours of home care than paid workers. Put another way, in 2007, roughly 3.1 million people delivered unpaid care to seniors in Canada, over 1.5 billion hours. A Senate report called Canada's Aging Population, Seizing the Opportunity, by retired Senator Carstairs and Keon in 2009, noted that family and friends provide about 80% of all home care to seniors living in the community and up to 30% of services to seniors living in institutions. À mon avis, le gouvernement fédéral et provincial
I believe that the federal and provincial governments need to take part in a collective study to assess the current financial support system in place to ensure that seniors have a basic income for a respectable and dignified retirement, and to eliminate the number of and to decrease the number of seniors living in poverty.
And provide support for improving seniors' social determinants of health. They include income, social status, social support networks, education, employment, continued working conditions, social environment, physical, provide personal health practices and coping skills, also looking at gender and culture. Ça devrait être aussi prendre en considération la façon que le gouvernement
It should also look at ways that the federal government can support the expansion and improvement of daytime recreational, social, and support programming for seniors, particularly for Canadians living with Alzheimer's disease or dementia. There are fewer day programs available for people living with these conditions, and they generally cost much more.
As a permanent member of the Status of Women Committee, last Tuesday, Tara Daly, a professor CIRHA research chair of the University of York, told the committee that these programs cost up to $30 to $40 a day, a cost which many seniors unfortunately can't participate and afford. A great example of this center that offers such a good programming, and they're here today, is in Ottawa is the Good Companion Senior Center. Thank you, Monique, and seniors and the board for being here today to supporting this motion. This day program offers seniors with acquired minimal assistance of $18 a day. And it's those types of programs that we have to look at best practice all across Canada. So I'm glad to see that they're here today, and the seniors from the centers are attendance in the committee today. I'd also like to thank Caroline Pollen, the Nurses Association, for being present and also participating in this motion. J'aimerais, pour terminer,
In closing, I'd like to express my gratitude to this committee for undertaking the study on how the government can support seniors today while preparing for the diverse and growing seniors populations of tomorrow.
For the committee for undertaking a study on how the government can support seniors today while preparing for the diverse and growing seniors population of tomorrow. Looking forward to your questions. Merci beaucoup, Miigwech.
Thank you, MP Saray. First and foremost, we have Mark Warwa up for questions. Go ahead.
Thank you, Chair. To Mark Sergey, thank you, and congratulations on your bill being before us here today. The issue of an aging population is a very serious issue for Canada to grapple with, and it's not just Canada, it's all the Western nations have an aging population. It was recently announced that there are more seniors in Canada now than there are young people. Right now, there's 1 in 6 Canadian is a senior. In 5.5 years, approximately, it'll be 1 in 5. In 12 years, it'll be 1 in 4. So this is a major shift in the population in Canada. And we need to get ready for that because already 50% of provincial and territorial medical costs are already 50% of those costs for medical expenses are for seniors. And if we then change the percentage, that means very likely we're going to have an increase in our costs for medicine in Canada. And yet on the other end of the equation, I believe it's 4.5 Canadians are working to support every senior in Canada, and that will be changing to 2.5. And so less people are working to support, but a greater need. So we need to be smarter and prepare for this. Some describe it as a tidal wave of gray. Canadians are living longer, living healthier, but there still are unique needs to Canadian seniors. So Mark, I want to thank you for raising this issue. This issue has been raised at this committee for the last 1.5 years, and it's unfortunate we didn't begin this study. In hindsight, we should have, but finally, we're now dealing with this. I also want to thank Dr. Avery and the Canadian Medical Association for the incredible work that they've done. I've been honored to sit on a panel with Dr. Avery in my riding of Langley at the Langley Senior Resource Center, and CMA did an incredible presentation there and met with Canadian seniors and answered the questions. And also, CMA, Dr. Avery, came and spoke to the Parliamentary Senior Caucus and provided great input and advice. What I've heard, Mark, from professionals in healthcare, senior healthcare, is it's not possible in those short 12 years to prepare to build enough housing to house house all this growing population. And it's not what Canadian seniors want. They would like to age in place. And so the importance of training healthcare professionals in home care, in geriatrics, in palliative care is critical to be able to take care of our aging population. And it's also achievable and it's affordable. As you pointed out, it's much more affordable to have somebody age in place. But we need the staff. Taking care of a newborn baby is very heartwarming and satisfying. So there's a great popularity in training in pediatrics, but in geriatrics, not so much. And even talking to people, how do we get people volunteering to visit rest homes, to just visit, to show dignity and kindness to our aging population, and just having somebody show them value, visiting them while they're lonely, and the people that have retired, that are now have the time to be able to do this, the common comment is, well, I'm going to be living in a place like this pretty soon, so I don't want to go near it any sooner than I have to, so no, I don't want to go visit. And so that's a dilemma. How do we engage Canadians to show love, dignity, kindness, care to our aging population? And also, as you pointed out, 85% of the support for seniors comes from friends and family, and in many cases at great personal costs, physically and financially. How do we support them? So my question to you, I've acknowledged your great work, thank you, but what is the government going to, number one, I hope the government will sometime soon appoint a minister for seniors, because I think the slowness of action from the government is because there isn't an advocate for seniors, and there's a minister for youth, and there's more seniors than there are youth. So there's a minister for youth, but not a minister for seniors. So hopefully you bring that message to the Prime Minister. We need a minister for seniors, and we need to get a plan, a strategy, which we're going to deal here. But are you also advocating that there's appropriate funding in the plan? Because a plan without an engine, without an allocation of funds and training, working with provinces and universities, are you going to be encouraging the government to make sure that there's appropriate funding in the next budget, allocations, to be able to make the plan work?
He's left you literally 5 seconds.
5 seconds.
I'm really sorry.
So what I'll say is,
I'll give you 30. Go.
I'll use 10. I'm currently, and this is part of the committee here, and also seniors caucuses and members of Parliament, currently working closely. Obviously, we have Minister Duclos. We also have Minister Philpott. We also have Minister Cultural when we're looking at accessibility, and even Minister Haydu. So we have several ministers right now looking at ways to improve the seniors' quality of life across Canada. So yes, I will continue advocating closely, continue working with you, all members of Parliament here in the committee and the caucuses, to ensure moving forward. We've already done some investments in our first two budgets, but moving forward, how can we better the quality of life for seniors?
Thank you. And over to Mr. Long, please.
Thank you, Chair, and thank you to MP Saray for, first off, your presentation and for taking the time and having the commitment to bring M106 forward. I think it's something that's very, very necessary for the country, and the fact that we're going to spend some time now studying this and talking about seniors and seniors issues, I think, is of utmost importance. And to echo my colleague across here, the numbers are staggering, and I certainly learned that during the campaign in 2015, going door to door by riding a St. John Ross, and certainly in Atlantic Canada, we have the highest percentage of seniors in Canada at 20%. Compare that with Alberta, that would have 12%. So Atlantic Canada is aging, and we know certainly nationally it's the first time that we have more seniors. I think it was 5.9 million seniors versus 5.8 of people under 14 years old. So, I mean, the numbers are staggering. And that, obviously presents a challenge for government. As people get older, they need more health care, home care, more government care. And I think you'll see the demands on government, obviously continuing to grow as time passes. So, we certainly have a challenge in front of us. But I think my first question to you, MP Surrey, is just with respect to, again, going door to door and talking to seniors and learning about seniors' issues. And certainly, there's more single seniors, more single female seniors across this country. But I just want to talk to you, if you can expand and tell the committee more about the need for Seniors Day programming. And how do you feel the federal government can support this better? What's the best approach?
Thank you for your questions, and thank you for the work you're doing in writing also, like all the MPs here. When we talk about day programs, and as I mentioned in my own opening remarks, we have the Good Companions of Ottawa here, and I know all of you have had the opportunity to meet with some of the seniors programming in your writing. The expanding the day program is so important, and when we look at also with the aging population, we look at Alzheimer's and dementia, and we also look at how do we get our aging population active, participating in the community. We have challenges in some rural areas with transportation. I've heard that in rural Canada versus an urban setting.
So how do you feel the federal government can support this?
So basically, one of the things we have to be working on is working with the provinces. Okay. It's crucial because when you look at the cost of a hospital bed for a day is $842. A long-term care bed is $126, and a day program is $4 or less. So how do we look at investments? We've done some investments already with the home care program in the provinces. Part of the home care program has components to try and encourage more day activities. And I've heard from many organizations and seniors how important it is to be active. And also when I reference the Senator's report in 2009, one of the critical elements of getting seniors involved also helps in many other areas. So from a federal perspective, M106 sets the wheels in motion for a dialogue and sets the wheels in motion to get the provinces involved, looking at best practices and how does that lead to local organizations, municipalities to follow through. So this is the first step. It's the first time in the history of the House of Commons that a national senior strategy has been approved by the House of Commons. So it gets the ball in motion for that.
And thank you for your comments. They're great and I appreciate it. But can you just kind of drill down and speak specifically how important you think Seniors Day programming is with seniors and people with dementia and Alzheimer's?
I think it's one of the number one issues that when we look at income security, I think income security is one of the number one. But when we look at programming, activities in our communities to engage seniors is crucially important. And I'm looking forward to seeing how one of the components of your study here will be looking at the social determinants from a senior's perspective and invite the committee to make sure to ensure that you invite witnesses to look at ways to improve day programs and look at best practices to share across the country.
That's great, and thank you for that answer. I just want to kind of switch gears. You just kind of led me into it, actually, but with respect to seniors' income security. And, I was very proud to be part of our government that, made changes to the GIS for single seniors living in poverty, an increase of 10%. Can you just elaborate to me on how the federal government can be a better partner with respect to helping seniors with income security across the country?
Brief response, please.
Sorry?
Brief response, please.
Income security. Well, obviously, as indicated, it's the first GIS increase in 30 years,
Yes.
the 10%. More is needed. We have a large percentage of seniors living in poverty. The GIS helped out over 900,000 Canadians, mostly women. Income security, we need to find ways from a federal perspective and also provincially, is find ways to ensure that we have more disposable incomes.
Sure.
For seniors, that we have seniors living with dignity in retirement. So how do we find ways to provide more income for seniors that are living in poverty, and they then have the choice to then look at day programs. They could choose the areas they want to participate. Right now, because of the low levels of income for seniors, they're limited with the choices they have to participate in, example, the day program that you mentioned.
Thank you very much. MP Blaney for 6 minutes, please.
Thank you. So I'm very happy to be here having this conversation after many years of advocacy from the NDP to have a national senior strategy. We're at a breaking point, and I think that we really need to face that reality that this is something that is much too late, but I'm still glad to be here. Of course, I want to appreciate Dr. Avery from CMA. Very proud that he comes from a community in my riding and understands the diversity of seniors across this country and what it means to be in a smaller community and what it means to be in a larger community. So your predecessor, the NDP MP for Nickel Belt, Claude Gravel, had worked for years to create a bill on the National Dementia Strategy. His bill was specific. There were requirements, actions to be undertaken by the Minister of Health to initiate a strategy. Unfortunately, his bill was defeated by a single vote in 2015 because a Liberal MP forgot to stand up. The motion we have in front of us does not offer that level of required action. Don't get me wrong, I'm really glad that we're here and that we're advocating for long-term NDP policies, but what's really missing for me in this motion is action. We will be spending countless hours creating recommendations for our parliamentary report, which may one day help shape a national aging strategy. I think in your motion it says provide advice on implementing a national senior strategy. But what assurance do you have that one day we really will have a strategy that's effective in moving forward for seniors in Canada?
Thank you for your comments, and I know on the dementia bill, and there's 167 other MPs that voted against it too. So I just wanted to clarify the record for that. Essentially, the action that we're taking today, we've added dollars in affordable housing. Mm-hmm. We're developing a national 10-year program.
Okay, so
we're
the
setting that
reality
in
is
place.
you don't. So there's more studies.
We do have this. Will be looking at this. Will be setting the stage. Mm-hmm. So what we're looking at here for the first time, there's been now an expression that.
But there's a lot of studies, and so one of them is from the Senate from 2009.
Yes, it's a very
they had a
one.
great report, 32 specific recommendations that have gone practically unanswered. So which one of these recommendations do you think this committee should prioritize? Which one's a priority for you? You were just talking about affordability. That's a recommendation. Number 8, supportive housing. You know, CMA has done a great job about talking about really seeing an investment in infrastructure for seniors. That's something that we desperately need across Canada. You know, the other thing that we talked about earlier was the GIS. That's recommendation 19.
Correct.
We've got pharmacare. So what do you think is the most important, and have you read the report?
So yes, I have read the report, and I'll correct you on, we have done action already. We've increased the GIS. We've looked at home care and mental health services with the province. We have an accord with all but one province signed already. So there's been dollars being spent for home care,
and
for mental health that will have an impact for seniors.
Really about
there's also the GIS.
Why, you know, the steps towards action. I really appreciate the
That's
motion. Right. I understand that we're doing this important work here, which is going to bring advice. But how do we know that this is actually going to translate into meaningful action? In my riding of North Island, however, I did 11 town halls. Mm-hmm. You know, we've definitely seen some steps, but the National Senior Strategy really addresses the issue that right now, like Stats Can has told us, we have more seniors than we do children between the ages of 0 and 14. This isn't something that was a surprise. Here we are, much too late, having this conversation. We knew that seniors' population was growing, that we needed a national strategy to address those issues in a meaningful way across all levels of government to really be of support to service providers within the communities and across Canada. So I'm just wondering, why was the focus of your motion really about more research instead of research with a real strong outcome of action?
Well, the motion itself also acknowledges a lot of the actions that we've already taken. When we look at it, the GIS, when we look at the like I said, home care, when we look at the mental health, also when we look at reducing the old age requirement from 65 to 67 to 65, we've already taken some measures, yes. And I agree there's more to be taken, but we have to acknowledge what we've done in the last year and a half. Also, I would encourage look at the participation from you and from the entire committee here on moving forward on other elements. Yes, it's pressing, but we have to look at what we've acknowledged, what we've done today, and then we have to look at moving forward. Developing a national senior strategy, you could have a national housing strategy, you could have a national home care strategy, you could have a national farmer care strategy. A lot of these, dementia strategy, all of these could have its own national strategy within. But let's take a step forward, and I'm proud that the federal cabinet, Parliament, has agreed for the first time, let's sit at the table, let's work with organizations, let's work with the province, let's work with members of Parliament to develop a national senior strategy. So I would encourage to continue your feedback, to continue your advocacy as you've been doing, so that we can look at specific ways to improve the quality of life of seniors all across Canada.
About 30 seconds.
So my response to that is I'm glad that some of these actions are being done, and I'm wholeheartedly happy to be here having this really important conversation that, like I said earlier, was long overdue. But what I'm also reminding you is a lot of the work has already been done, and so we are now here asking seniors to wait. So my question to you is, how long do you think it's acceptable for seniors across Canada to wait for real solutions that are going to make a difference in their lives?
Very, very brief.
900,000 seniors are very happy with their increase in the GIS. That's to one. Many seniors are happy with the reduction from 67 to 65. Many seniors are now looking at the affordable housing component. Many seniors are looking at the home care and mental health services. So we have some successes that we've done. Right now we have to build upon it. So I disagree that you're saying that we haven't taken any action. We have taken some action. We need to do more, and this is part of the process here.
Thank you, sir. Now over to MP Robillard, please.
Bonjour, Monsieur Serry. Bienvenue. Good morning, Mr. Serry. I'd like to welcome you to this committee, and I'd like to congratulate you on your motion. And I'd like to applaud your efforts aimed at helping our seniors. I have two questions for you. I'm convinced that as part of your preliminary consultation, the theme of the isolation of the seniors has often come up. However, I would like to know what you think about the technological isolation of our seniors and the importance of this issue as part of a national strategy for seniors. Do you think that it is important for a strategy on this matter should take into account the fact that many of our seniors are isolated because they do not have the necessary tools required to make use of modern technology and the full potential offered by it? I'd like to thank you for your question. I think it's an excellent question because when we take a look at developments in technology, we've waited for a certain amount of time. There are certain organizations that are taking advantage of what is happening. We think that is an important element that must be considered in the education of our seniors and to ensure that our seniors are in a position to take advantage of different activities through technology. One of the programs that we've been looking at is a day program, and it's included by most of these programs, that is access to information technology, to Facebook, because the greater the information provided to our seniors, the more they will be in a position to take advantage of technology. and very often it involves family members. So it's important to find ways of making use of present technology, and this particular day program is a way of ensuring that seniors at home or in residences will have access to technology to find out about what is happening. I'm 50 years old and I still have trouble keeping up to date with evolving technology. So I'm sure that this is probably a significant challenge. Yes, thank you. I think that these people are certainly willing and ready to learn. And it would be useful if families helped them by providing them with the instruments as well. I'd like to come back to this question. The 2017 budget announced that $29.5 million would be invested over a 5-year program for a new program of digital literacy for nonprofit organizations that would be implementing certain initiatives where, among others, seniors would be provided with basic digital competence. Throughout the country, our seniors are learning, for example, how to make use of an iPad in order to be able to communicate with their grandchildren. Do you think that a national strategy for our seniors should be encouraged? Yes, I think that it is very useful when we're talking about iPad or social media. There are a number of seniors who are on social networks and who are not do not understand certain types of frauds or scams. And I think that this is an issue that probably should be raised since we're talking about education in general. It was mentioned on a number of occasions, and I think Lynn MacDonald, an NDP member, carried out a study on this. I think that it is probably an important issue because it is important. My grandparents, for example, uncle and aunt, do have access to internet and Facebook. And I think that we have to consider how we can look at it from that particular angle.
Okay, you have about a minute, sir.
Okay, a short question in 1 minute. That will be that congratulations first to you for initiating this 106 motion. And see, I being a senior, I come across with the seniors in Brampton. I visit their facilities. I find that they have got health issues. Health issues means they are not able to reach to the doctors in a proper way because they can't. There is a federal, provincial legislation problems and other things. So seniors, they think themselves that they are not being provided the full help which they are required to have regarding their medication. So what you suggest to the committee today here, that what steps should be taken to facilitate that they get their medication filled up easily and have the possibly doctors and others, chiropractors and others visiting them very oftenly.
Very, very brief, please.
Very brief. I don't have any specific recommendation on medication for seniors, or unfortunately, I can't provide any specific recommendations other than now that we've established the need for national senior strategy. Let's get the dialogue going, and because it is a very important issue, and it also falls into a bit what we talked about on the education side. We're looking at family physicians, very important when you look at the overall, but also nurse practitioners. How does that come into play, and the education related to that? So very important. But I don't have any specific recommendations for your questions.
Thank you, Mr. Rubin, please.
Thank you very much, MP Thuray, for being here today and for all your work on this file. This is obviously it's a complex issue. Studies have been done in the past, absolutely. We just finished doing our poverty reduction study, and from that we heard from a wide variety of vulnerable people, including seniors, some of the challenges that they've faced. And I like to think that Budget 2017 actually, some of the elements in Budget 2017 is actually because of the witness testimony that we heard. And a great example of that is the housing situation. And we have, in Budget 2017, allocated $11 billion over 10 years. This is unprecedented. $11 billion over 10 years to housing. And that's not just, that's for low income, that's for seniors, that's for shelters. This is unprecedented. So the suggestion that we're not acting, does that make sense to you? Or do you see some that we are moving forward on this file?
As I indicated earlier, we are taking many actions in our budget 2016 and 2017. So we have, and the minister will be speaking to the committee and outlining a lot of those that we've done in these two first budgets. And I would encourage the committee to look at the following budgets. As we indicated earlier, there are elements in play that we could look at to support, but if we look at the housing strategy, when we look at home care, when we look at mental care, there is a lot of good elements in that right now to look at how can we better improve the lives, the quality of life for seniors. More can be done, yes, but we need to have that dialogue to make sure that we have our partners, the provinces, community organizations, municipalities involved in that dialogue.
Thank you. Before I got elected, I owned a coffee shop bookstore, and we had lots of community engagement. We had lots of events. And what I saw were seniors that were involved, 88 years old, that were coming to the shop and getting involved in the discussions that we were having and interacting with young people. They were healthier, they were happier, quality of life, you could see that. And the flip side of that was I saw a lot of seniors who, for whatever reasons, wouldn't leave their home. They wouldn't go out and get involved. So they would stay home, they would watch TV if they had cable, and because they weren't engaging with anybody, their health starts to deteriorate. And that's a shame, because the wealth of knowledge that they bring to our country is incredible. So the question I have for you is, how do we tap into that and encourage them to get out? What are the pieces that are missing for them to actually get involved in the communities? Because that's extremely important aspect of this.
And I totally agree with your comments and answer in two ways. One is when we look at what we indicated earlier about day programs, very crucial that we look at reinforcing, expanding the day program, including technology and other activities, and looking at transportation for rural aspect. The other important element here, as we talked about, is seniors caring for seniors and caregiver. So I would encourage the committee to really look at how can we support caregivers, how can we support family members caring for seniors, and there's there's multitude of different recommendations along those lines to support financially and other ways of tax credits, or there's kind of elements, but we got to find a way to look at how can we recognize the importance of caregivers in the strategy and in the lives of seniors across Canada today. Caregivers are supporting many, as I indicated, 80% and today. So how can we recognize them? And also when we look at seniors and the value that retired seniors right now are providing on a volunteer basis to many of the homes, and it just, the stories are amazing, and the commitment and the work, but we're not probably as a society recognizing the caregivers enough, and it could be spouses. I have my mom right now looking at my dad that's just been diagnosed last year with dementia, and her health is not the greatest, but she's taking care of my father, but I'm afraid that her health will deteriorate. So how do we look at balancing that and having day programs and having a break for some of the living caregivers like my mom? So it's very important to be doing that. So I appreciate that, and we got to find ways to make that happen.
Thank you. And because you mentioned it, yes, unprecedented $6 billion to home care, something the federal government has not done. So that's another thing that we have taken action on, and it's up to the provinces to work. But I want to go quickly into, when we're talking about seniors, they're very vulnerable for plenty of different reasons, and that's why it makes it so complicated. But one that keeps coming out, and we heard this in our poverty reduction study, is seniors abuse. Whether it's in the family home, whether it's inside institution, that there's a huge problem there. Any thoughts on how a senior strategy can help to fix this?
Definitely, it's an issue that has come up. I mean, it's not something that I hear, I've heard on a regular basis, but it has come up as an issue. And as I indicated earlier, Lynn McDonald has done a study in 2015, just recently, looking at about looking at a large percentage of this abuse. The recommendation, as I discussed earlier, is how can we look at enhancing the education components, literacy, computers, trying to see the technology. How can we enhance the education via day programs to look at that engagement? Because the number one issue is isolation for many seniors. If they're not part of, they don't have large families, they isolate themselves. And if you isolate themselves, then it's an issue. And so that one of the, how do we get more of the activities, these programs in place to support that? So
Thank
that
you.
would be better.
Thank you. Thank you very much. And Karen Vecchio for 6 minutes. Go ahead.
And thank you very much. Mark, first of all, I think I want to clear the record here. You noted something about the GIS and the first in time and an increase. And I know that there's been multiple budgets prior to this budget where there has been multiple increases as well. So I just want to clear the record on that. I want to go back to when we're looking at old age security. And it's kind of looking at where is the future going to be? I fully recognize that our seniors need support now. We need the palliative care, we need the home care, we need a variety of cares for them. But we also need to look into the future. And last night when I was speaking in the House of Commons regarding Bill C-44, I was talking about the servicing to debt that we have to do. And right now, back in 2015-16, over $62 billion was spent on servicing our debt. We know with the current government that there's going to be continuous debt loading on here. So 62.8 for 2015-16 is we're going to see an increase, of course, with that. Now, I recognize that there was many concerns over the increase in the old age security from 65 to 67, and that is one thing that your government had campaigned on, and had people believe that this was the best thing, because from my own experience, people of this generation thought that their old age security was going to be taken away from them, although the changes to old age security wasn't starting until 2023, and were impacting my older sister, who is just 55 years of age now. So looking at the fact that we have to service all of this debt of over $62.8 billion just in 2015-16, so that's the amount of money that we're spending out. We know that in the future, it's speculated that the ratio of seniors to workers is actually going to be 2 workers for every senior. And I think when we're looking at all of these things, how is it that we're going to be able to continue to prioritize and have good services for all Canadians, whether it's education and health, without studying the impact, the old age security, and looking at reviewing the age eligibility once again? And I'm wondering if with this study, if that's something that you would consider, knowing that 2-to-1 ratio is expected in the next 12 to 15 years, as well as the enormous debt that we're going to have this country in. So I'm asking for the 46-year-olds of this country like myself and like Wayne. I'm giving you a call out there, Wayne. We know you're not 46, but I'm asking for the future generations, because when we're looking at it, we've got today's generation, but we do have future generations of seniors. Mm-hmm. What are you willing to do on this study, and are you willing to look at the old age security eligibility being increased, knowing that these ratios are also going to be diminishing?
Well, the first comment, I'll let the committee members decide on the angle of the study itself. So I think you've already looked at some of the parameters. For me, as I campaigned on this and I met seniors, I feel very comfortable talking to seniors in my writing about the fact that we reduced it from 67 to 65. Mm-hmm. So I think that's something that I'm proud of a government's campaign promise and doing it. So that's something. So I'm just wondering if you're suggesting that we have to find ways, because that eliminated, I can't remember the exact number, many seniors living in poverty from
Well,
looking at from
the
the
problem
67
that we're
to
having
67.
is there was such a dialogue that was going off in tangents where there was what people believed and what was actually happening were two different things. As a constituent assistant for 11 years, I had people coming in and asking me, when does my old age security get reduced? Because that was the messaging that was getting out there. Very well done, and bravo to those people who were sending that negative messaging out. But as I indicated, it was not going to affect anybody till 2023. There was not one single senior at that point of time that was going to be affected by the changes in the old age security. Now, that being said, I do recognize that for some people it's difficult. If there was a 70-year-old man married to a 50-year-old woman and they have to look at the allowance and the GIS, there's different things that we need to look at that. But the fact is, not one single senior in the 2015 election, 2016, 2017 was being affected by these changes in the 2012 year that the former government put forward. So what I'm asking is, do you think it is necessary with the changes that we're going to see in our demographics that old age security is reviewed so that future generations can also have it, because we recognize the debt ratio is going to be an issue as well as the work ratio. So do you think that's something that should be studied in this as well?
Short answer, no. I think it should remain at 65, and also part of our government's commitment, we work with the province to look at enhancing the CPP and to look at how can we look at enhancing that part. So the short answer, no. I think it should stay at 65.
You think old age security will be sustainable with two employees for every senior in 2030? Do you? Because I'm saying, as a 46-year-old person, I have 19 years to address my retirement as well. But we have to understand, when this government is piling on debt and debt and more debt, our priority is we're not going to have a lot of money left, and all we're going to be doing is taxing more and more people. So that's why I have this question for you.
My comment on that is that we have to find ways to support our seniors. We have to find ways to support income levels and seniors in retirement. We have to find ways to do it, and we have time to plan for it now. So let's do it.
Thank you.
Okay. Now over to MP Dillon, please.
Thank you so much for coming in, MP Serre, and for your motion. My first question is, how important is it to measure the impact of what we have done before commencing another round of programs to make sure the predicted impact is felt by seniors?
So I think it's very important. My motion did talk a bit about what we've done, and today we've talked about our two budgets in 2016 and 17. I think it's very important. We'll have Mr. Duclos also talking further some of the successes that we've already had. So I think, yes, to answer your question, it's important to recognize what we've done. Now, let's look at how we move forward. We've talked about the HUMA committee doing the study, but also the motion we haven't talked about is reforming the seniors, National Seniors Council. Right now, there's 5 vacancies, and encourage Canadians to apply online to be a member of the National Seniors Council, because that council will be making recommendations. We'll be taking your recommendations from the committee here, but we'll also look at engaging professionals, experts all across Canada, and we'll also be making recommendations to the ministers, to all of Cabinet, but also to the ministers I indicated earlier that have a specific portfolio related to seniors. So engaging the Seniors Council is very important, and acknowledging what we've done, but also moving forward on new initiatives is very important.
Okay. And on housing, let's be clear, we more than doubled the base funding last year from 2.2 to 4.8 billion. We are adding 11.2 billion for a new housing strategy, and are also adding $10.9 billion in new below mortgage loans and guarantees when combined with the renewal of operating agreements and health accord. It's a significant program. How does it need to be profiled and delivered to accommodate an aging population?
Well, the Canadian Medical Association has made recommendations along those lines. They've consulted Canadians too. When we look at, like I said earlier, 9 in 10 senior Canadians say that housing is one of the #1 priorities, and they want to remain in their homes, but also when we look at affordable. And that's the key here. And as we're developing a national housing strategy, we got to make sure, and I'm encouraging the committee and all members of Parliament to advocate that we make sure that we have a strong component on affordable housing and accessible housing, which will benefit a large portion of our seniors. We'll have an envelope nationally for housing strategy, but we got to ensure for the advocacy that we're doing to ensure that we have a large proportion that is directly related to seniors and affordability and accessibility. We have currently a lot of seniors housing that are not accessible. I've heard many that were built 20, 30 years ago, and I've met quite a few in my riding itself. They're in an apartment building. There's stairs, no elevator, and they're seniors. They got to move, and it's very unfortunate that the current housing is not accessible to seniors. So we have to find ways to adapt that, and I would encourage all of us to when we look at our minister and the work that our parliamentary assistant Adam Vaughan has done on this file, is ensuring that we have a large component that is affordable, accessible, and I know from talking to our parliamentary assistant that this is a priority to look at urban and rural to make sure that that is accessible and affordable.
Okay, I think I have time for one short question. Okay, for the last 10 years, we had debt without growth, and so programs for seniors were stalled or cut. How critical is it to invest in seniors programs like housing that not only deliver services, but grow the economy, deliver new jobs as a way of making sure growth pays for new services and new services for the economic vitality of Canada?
Well, this is a good question, and I know your work on the Status of Women Committee, and we've heard a lot of the infrastructure spent that we've possibly done in the past, like roads and bridges, which are important to municipalities, but also infrastructure spending in social programs. And we look at seniors' affordable housing. When we look at the infrastructure, that's important that we focus on social infrastructure. Supporting municipalities is crucial, and supporting social infrastructure linked to affordable housing for seniors is also very important. And I'm glad to say that we're moving toward that direction, and it's something that we need to continue making sure that we advocate on behalf of seniors. Seniors deserve a better quality of life. Seniors deserve respectable income for retirement, so they could live in dignity and participate. And that's the key. The last message I would, Mr. Chair, just to say that when we look at the seniors today want to participate, want to be active, want to be involved, they want to contribute back, and we as members of Parliament, as various organizations, have to find ways to channel that energy, channel that experience, and ensuring that they support us in our decisions moving forward. And as a priority, as a government, yes, we have to balance a lot of different needs, but I strongly believe that we are going to be a better country if we focus and get our seniors more involved, and the quality of life will be there for them.
Thank you so very much.
Thank you, Mark. And on that note, we do have to suspend for a moment to allow for the minister to come in. But thank you very much. Congratulations on your motion getting to this point, and we look forward to studying this with you. Thank you. We'll suspend for just a few moments, guys. We're back. Welcome back. It's my privilege and honor to welcome Minister of Family and Children and Social Development, Jean-Yves Duclos. Thank you so much for being here today, sir. I understand you're accompanied by Catherine McDade, Senior Assistant Deputy Minister, Income Security and Social Development Branch with ESDC. Welcome as well. And thank you for being here at the onset of what I expect to be a very fruitful study. We just heard from the author of M106, MP Mark Surrey, and looking forward to hearing your perspective, sir, and giving you the next 10 minutes to introduce. Thank you very much.
Mr. Chair, committee members, thank you for giving me the pleasure and privilege of being with you this morning as you begin your study of how the government can support and must support vulnerable seniors today. As you highlighted, I am accompanied by Senior Assistant Deputy Minister Catherine McDade, who will be able to provide details as necessary. This study was prompted by the motion put forward by my colleague Marc Serré, Member of Parliament for Nickel Belt. We should all commend him for his commitment to seniors and his interest in Canada's aging population. The motion included a request that the committee study the development of a national senior strategy and report back to the House. The government is as committed to seniors as I am. This is why we supported the motion inviting HUMA to undertake this study.
Canada is one of the main reasons I entered into politics. Before I ran for office, I spent 23 years as a researcher and professor at Université Laval, where Canada's aging population was one of my primary research interests. A few years ago, as the members of this committee are aware, the previous government decided to increase the age of eligibility for old age pensions from 65 to 67. I became worried because it appeared that the government at the time had conducted zero scientific study on the effects of this change, especially on the most vulnerable seniors. The previous government appeared not to bother to count and appeared not to bother to care. So I did what any economist would do. I went looking for the facts, and I put together a small research team that studied the likely impacts of that change in the age of eligibility. We found that the change would plunge 100,000 seniors aged 65 and 66 into severe poverty every year. This would have tripled the poverty rate of those seniors from 6% to 17%. As for elderly women, these would have been the most affected, with their median income dropping by a third. Vulnerable seniors would also have been the most affected by the change, but the least able to protect themselves by adjusting their work and savings behavior. I thus entered politics to be a voice of advocacy for the aging population in Canada. So I am especially pleased with the work done by our colleague from Northern Ontario, and with the collaboration of your committee, Mr. Chair, in undertaking a study of the well-being of Canadian seniors. This topic is of great importance to me as a minister responsible for seniors, to our government, and I am sure for all parliamentarians. Votre étude arrive à point nommé. Statistique Canada a publié récemment les données du recensement de 2016. Le recensement montre qu'entre 2011 et 2016, le nombre d'aînés a augmenté de 20 %. Il s'agit de l'augmentation la plus prononcée depuis les débuts de la Confédération. À titre de comparaison, la population globale du pays a augmenté de 5 % au cours de cette même période. Selon les projections démographiques, les aînés représenteront environ 23 % de la population totale en 2031, comparativement à 17 % en 2016. Ces changements présentent à la fois des défis, mais aussi des opportunités, et je m'attends à ce que votre étude soit très utile sur ce plan. The government has been working to implement the seniors agenda to advance 4 primary policy objectives, namely A, improving seniors' access to affordable housing, B, improving the income security of seniors, C, promoting healthy aging and improving access to health care, and D, fostering the social inclusion and engagement of seniors. We believe, and I think you all believe, that all Canadians deserve access to housing that is safe, accessible, and affordable. Housing is a key aspect of building any inclusive society. Our government has therefore been very active in improving seniors' access to affordable housing. Through Budget 2016, we invested $200 million over 2 years in the construction, repair, and adaptation of affordable housing for seniors. Budget 2017 further proposes to invest more than $11.2 billion over 10 years in the implementation of the first ever national housing strategy. This will help build, renew, and repair Canada's stock of affordable housing and help ensure that Canadians, including seniors, have affordable housing that meets their needs and improves their lives and those of their communities. I am looking forward to your deliberations and recommendations as we develop together a national housing strategy to re-establish federal leadership in housing, especially as it relates to the very important issue of housing for seniors. But that is only part of the solution. We must also tackle broader issues such as social inclusion and healthy aging. On this, I am especially pleased to learn that your committee will study this issue prior to the summer recess. Le gouvernement a agi avec détermination pour améliorer la sécurité du revenu des...
Our government also took measures to improve the income security of seniors. One of the first things we did when we took office was lower the age of eligibility for old age security and the guaranteed income supplement from 67 back to 65. We also increased the maximum amount of the guaranteed income supplement top-up by up to $947 per year for single seniors. This has improved the financial situation of close to 900,000 people and allowed approximately 13,000 Canadian seniors to exit poverty, the vast majority of whom are women. We have also introduced legislation to ensure that couples receiving the guaranteed income supplement who are involuntarily forced to live apart are able to receive benefits based on their individual income. All Canadians should have access to a dignified and secure retirement. Looking ahead for tomorrow's seniors, we therefore enacted legislative changes to enhance the Canada Pension Plan. The Canada Pension Plan enhancement will increase retirement benefits by increasing the replacement rate from 1/4 to 1/3 of pensionable earnings. It will also increase the limit of pensionable earnings by 14%. This enhancement will be phased in over a 7-year period beginning in 2019. Among other things, these changes will reduce the number of families at risk of income insecurity in retirement from 24% to 18%. My colleague, the Honourable Jane Philpott, Minister of Health, leads our government's efforts with respect to healthy aging and access to health care, which form an important part of our senior agenda. Under her leadership, the Government of Canada has advanced a number of initiatives benefiting seniors, ranging from new funding for provinces and territories to invest in home care, to advancing the implementation of age-friendly communities in Canada, to working with partners to address dementia. I encourage you to take a close look at the effects of the effectiveness of these programs. Finally, in support of our fourth policy objective of fostering the social inclusion and engagement of seniors, we are making investments that enable seniors to be active independent, and to contribute fully to the development of their communities. For example, through the New Horizons for Seniors program, we are collaborating with local governments, institutions, and organizations to reduce the social isolation of seniors and improve quality of life for Canadians. Through the leadership of the Honourable Carla Qualtrough, Minister of Sport and Persons with Disabilities, the government is developing accessibility legislation that will remove barriers in areas of federal jurisdiction. This will help improve access and foster inclusion for all Canadians, including the elderly. Our government also recognizes the critical role that many Canadians play in supporting family and friends with serious health conditions, disabilities, or aging-related needs, often while balancing work and other personal responsibilities. For this reason, Budget 2017 commits nearly $700 million over 5 years for the creation of a new employment insurance caregiving benefit that will cover a broader range of situations where individuals are providing care to an adult family member. We are working also to advance the work of the National Seniors Council. The Council reports to both me and Minister Philpott on challenges and opportunities related to the well-being and quality of life of seniors. The strength of the Council lies in the expertise and experience of its members. That's why, as terms of current members end, Minister Philpott and I will be using the government's open, transparent, and merit-based appointments process to fill them. In fact, a call for nominations for both the chair and members of the Council was launched on May 18. In conclusion, through all the measures I have described, the government is seeking to improve the social and economic inclusion of seniors. We have taken significant steps, but of course there's much more to be done. I therefore trust that your report will contribute to the effectiveness of the government's actions in favor of our seniors. Thank you very much for the opportunity to speak with you, and I would be very pleased to answer any questions you may have. Thank you very much, Mr. Chair. Thank you very much.
We have MP Warawa.
Thank you, Minister. It's a treat to have you at the committee, and there is such a thing as a good Liberal, and I would suggest that you are. We are well respected. At the beginning of your comments, you said that the government is as committed to seniors as I am. I would suggest that, or at least hope that your commitment far exceeds what we've seen to the government from the government to this point. And I appreciate your commitment to help seniors. As you know, we have a very quickly changing aging population in Canada. Right now it's 1 in 6. Approximately 6 years it'll be 1 in 5. In about 14 years it'll be 1 in 4. And you highlighted that in your comments. The vast majority of Canadian seniors would love to age in place. And it's also the only practical, affordable way to take care of this aging population is to permit them to age in place. We cannot afford to build enough housing, and it would not be appropriate to warehouse our Canadian seniors. It's not what they want, and it's not what we can afford. And we don't have enough time to build enough houses to house them. So for all those reasons, we need to focus on aging in place. In your comments that you shared that there's a national seniors housing strategy, and that's going to include some housing for seniors. And we do need to provide some more housing for end-of-life care, palliative care, hospice care. We need those extra beds for that. But a major focus needs to be on providing home care. You touched on that. You said that the Minister of Health in the negotiations and agreements with the provinces and territories included investment in home care. So that's a question on that. and then I have one for you on access from the Minister of Sport. So could you provide details of what is the government going to do to ensure that we have home care that meets the needs of an aging population? Is that going to include a number of new people to provide that home care, training in geriatrics, palliative care? Is that part of that agreement with the provinces?
Thank you, Mark. It's always a pleasure to receive such questions of not only deep value but also deep concern for our seniors. I share entirely your view as to the circumstances and the will of our seniors. Our seniors in most cases want to age at home, and that's why it's so important to look after all of their needs that will ensure that they have this ability to stay at home. And in that context, housing, as you say, is a key issue, and we are, of course, going to make progress over time. Housing takes time to renovate and to construct, so the impact will be seen over a relatively long time period. As you also signal, housing makes sense when it comes to aging in dignity and security, when services are also offered, proper services, and healthcare services matter, of course, a great deal. So the investments that the government is making in supporting provinces and territories and providing home care, that I think will make a difference and will provide the type of support that you rightly mentioned.
Okay, and do I have another couple of minutes?
Almost two.
Thank you. And you touched in your presentation on the Minister of Sport and Disabilities that the government is developing accessibility legislation. One of the number one causes of shortness of life and injury to seniors is their accessibility so that they can age in place, and if they fall, and the likelihood of a broken hip and pneumonia, and then their life ends very quickly. So accessibility is critical. A ramp to the front, particularly after a stroke, you would have an occupational therapist assess where they're living and how do you make that home livable so that they can age in place. So when is this legislation, accessibility legislation, when are you going to be introducing that in the House? This all needs to happen fairly quickly, and to be honest, I'm disappointed it took a year and a half for us to see this, even the discussion we're having today. This all needs to move very quickly. When are we going to have legislation that you referred to in your speech?
Thank you again. As we know, this is going to be the first ever federal accessibility legislation, and we all look forward and we're all eager to see it into place. I would like to give you a more precise timeline. I would prefer to delegate that to my colleague, Minister Qualtrough, who would be better informed than me on the precise timing of the law. This being said, we all agree that accessibility matters for all Canadians, in particular, again, for seniors, as you rightly stressed. Our seniors age in different manners. In many cases, they require adaptation to their housing in order for them to stay at home and to live well. So I expect that accessibility legislation to make a key difference in the lives of many of our seniors and to achieve exactly those objectives. On the details of the timeline, again, I would delegate to my colleague.
One quick point, I would suggest that if there was a minister for seniors, as there is for youth, that we would have better guidance and a stronger voice in the government. So I continue to ask, and actually most Canadians would like to see a minister for seniors.
Thank you, Mark.
Minister.
Now over to MP Long, please.
Thank you, Chair, and thank you to Minister Duclos for coming in and presenting to us today. Minister, I just want to thank you so much for your leadership and your passion and the direction that you're giving the government with respect to those living in poverty. And obviously today we're talking about seniors. And we have an issue across this country, and we have a challenge, but with every challenge obviously comes opportunity. And I was reading up last night, and I mean, the stats are no surprise that for the first time, I think in our history, we have more people, 5.9 million in fact, of senior age versus those 14 and under at 5.8 million people. Just a side number, there's 8,230 Canadians that are over the age of 100. And those numbers are actually startling. So, with an increasing seniors population, and in particular, I come from the riding of St. John Rothsay in Atlantic Canada, and we do have the highest percentage of seniors in Canada at 20%. And you look at that versus, say, the West Coast at, say, Alberta at 12%. So we have our challenges in Atlantic Canada, and certainly one of the things that I learned going door to door, and it was a learning curve and a learning process for me in 2015, talking to seniors door to door about how seniors did feel forgotten, how seniors were concerned about the change in eligibility age from 65 to 67. And I used to talk to a lot of seniors as to, what do you feel has happened, or what is out there from a government perspective to benefit you. And, a lot of people talked about, or certainly the previous government talked about, the tax-free savings account. And, I talked to many seniors, certainly in St. John, and those living in poverty, and they didn't invest in a tax-free savings account. They didn't have any money to invest in a tax-free savings account. So I think, first and foremost, Minister, my question to you is, from a government perspective, from budget 2015, or 2016 and 2017, can you just elaborate on the steps that our government has taken to change the lives of seniors and to pull seniors out of poverty and provide a better life?
Thank you, Wayne, and let me very quickly, because I don't want to be too focused on your own work, knowing that everyone's work around the table matters immensely. But I've had the fortune of seeing you in action in your writing, and I have seen your passion and your compassion for those Canadians that need better help and better support when it comes to being and doing well.
Sorry, but you're not allowed to take photographs during the committee. Thank you. My apologies.
I forgot to put my. What did you say, Mr. Chairperson?
Apologies. Go ahead.
Okay, good. Thank you. Now, coming back to the change in the age of eligibility, we all know how important the challenges, but also the opportunities are for an aging society, an aging population, and there are ways to improve the living conditions as well as the savings and work behaviors of our senior citizens. However, this must be done with great care, and if with the appropriate sensitivity to the well-being of the more vulnerable seniors. And when that change was made, unfortunately, and I'm saying this with complete transparency, unfortunately, too little evidence was produced on the adverse impacts that this was going to create on our more vulnerable seniors. Those seniors that would have been the most affected by this change in the age of eligibility would have been those seniors that had the least ability to protect themselves through changing their work and savings behavior, while enduring the greatest impact. Just to give you two figures. The top 20% of those seniors aged 65 and 66 would have lost 5% of their income. The bottom 20% of those seniors would have lost 35% of their income. Women, men, median men in that age category would have lost about 10% of their income. The median woman would have lost 33% of their income, and that's because women in that age group are more vulnerable than men. So a social sensitivity lens would have been useful in that debate before thinking of implementing such a dramatic change that would have, again, plunged 100,000 seniors into severe poverty. So I think it was important to recognize it very early in our mandate, and this is what we did by changing the age to 65.
Okay, certainly one thing, and thank you for that, Minister, one thing that I was very proud to advocate for and tell people door to door in St. John Rosse was the increase to the GIS of 10% for single seniors living in poverty. Can you just elaborate to the committee on what kind of effect that had and how many seniors that affected?
Brief answer, please. Thank you.
Short?
Short, yes, thank you.
So the overall impact is for 900,000 seniors, up to $950 per year for each of these seniors. Now, for some of us around the room, $950 might seem a relatively modest amount, but when you live in very severe economic circumstances as a vulnerable single senior, that makes a big difference. And the impact on poverty, as I said, is 13,000 seniors, vulnerable seniors taken out of poverty. And again, the vast majority, 90% of these seniors are vulnerable women. So the gender lens, again, when it comes to seniors, is very important. Not only are women more in greater numbers, they also happen to live longer, and they often find themselves in more vulnerable economic and social circumstances.
Thank you very much, Minister. Now for 6 minutes, MP Blaney, please.
Thank you so much, and thank you, Minister. It's very nice to have you here to talk about this very important issue today. You know, I have the honor of representing North Island Powell River, which is a very large riding with many rural and remote communities. And today, as I listen, I can't help but think about Sayward, a population of 340 people who have created a volunteer program so that they can have health services provided in their community. They now organize everything so that the nurse can come into the community and do that work. So a lot of seniors across Canada are now at a stage where they may be economically really vulnerable, but at the same time having to step up to the plate to care for a loved one, for a partner, or to organize something like they have in Sayward. So I hope that that's something we all remember in this place when we discuss the importance of having a national senior strategy. So my question to you is fairly simple to start off with. Is a national senior strategy a priority for you? You talked about a lot of the priorities, the 4 priorities that you mentioned in your report, but is the national senior strategy an actual thing that you're moving towards?
The reason I'm here today is exactly for that purpose, is to encourage encourage the committee to provide their views on whether this should be a priority for our government. I have my personal view, and I would say that the actions we've taken in the last year and a half demonstrate, I think, quite clearly that view, that we feel that the well-being of seniors is a key mandate a key element of my mandate as minister responsible for seniors. So I'm certainly very enthusiastic and very supportive of your work, and I look forward to your report on how we can move forward in the manner you will judge the best design, so that we can address all of the very important challenges and opportunities that our aging population presents.
So when you received this report, you will have been 2 years in your mandate. So I'm curious, why do you feel it's taken so long for this priority to actually come to the forefront? Is there a national senior strategy already in works? Is that something that your office is already working on? What steps will be taken when this report is given to you? And do you have any sense of a timeline? I think one of the things that I've heard loud and clear not only in my writing, but as seniors critic for the NDP across Canada, that seniors can't wait. They've been waiting a long time. They've needed some of these solutions. You know, they appreciate some of the steps, but the reality is poverty is overwhelming. Housing for seniors is overwhelming. And I think most importantly is all the gaps. You know, again and again, when I did the 11 town halls in my writing, what I heard was from seniors is, we don't care what level of government deals with this. We want all levels of government working together so that these big holes aren't there for us to fall through. And so as we see the aging increasing, as we see the vulnerability increasing, what is the timeline for real action? Because, you know, Canadians, they appreciate that we have to do our work. They want to see action. They don't want to see another report.
Thank you again. Well, if we're looking for actions, I think the last 18 months have been very clear. Now, in less than a year and a half, what I summarized a few moments ago speak extremely loud. The change in the age of eligibility, the increase in the guaranteed income supplement, the substantial investment short-term and long-term in housing, the remarkable investment in home care, in health care for provinces and territories, the enhancement of the CPP, the Canada Pension Plan, which many Canadians thought would require a long time to process and negotiate with provinces and territories. It happened 9 months after the government was elected. So these actions speak very loud, and now what we're looking forward to receiving from you in the committee is how to make that coherent in a broader framework. So how a national seniors strategy could make all of that fit even better together.
So you talked about the National Seniors Council in your report. Do you agree that the National Seniors Council should have more leeway? And if so, ultimately, you have the power to ask them to report back to you, but we've only seen one public report in the last 2 years. So with the reality that we're facing of growing seniors in our country, that there are these gaps that people are falling through, that the vulnerability is increasing, why aren't you taking full advantage of their expertise?
Sorry, that's a very good question. We've had the fortune of meeting and talking with the members, the current members of the National Seniors Council. We've received some very useful advice from them, and I would summarize that advice in around two different lines. The first is that they want to have more freedom when it comes to guiding the government around the seniors' agenda, and second, they want to have also more independence when it comes to providing their advice. So freedom of choice and independence of advice, and that's what we hear from them. And certainly, these are the options that we are currently following. My colleague, Minister Philpott, and I haven't made the final decision as to the future structure and mandate of the Seniors Council. But again, this context is perfectly suited for the committee to provide its own input into that reflection and the following actions that will take place.
Thank you. Thank you very much. And now over to MP Robillard, please.
Bonjour, Monsieur le Ministre.
Good afternoon, Minister. Thank you for coming here. I am confident that our seniors at the heart of your concern, among various actions already undertaken by your department. Could you tell us more about the program New Horizons? The constituents in my constituents have benefited from this. I'm sure that this is the case for many others. Do you consider that this program does support a national strategy for seniors? I'm very happy to hear from you. And I know that in your community, we've talked about this on several occasions, and also about my own community. This New Horizons program for seniors has created a significant difference. There's not only the desire to take care of them, but also the desire to take care of their community. Most of our seniors are living in better health conditions. They're living for a longer period of time in better health, and most of them are more available to make a contribution to the development of their society in an environment that counts to a large extent on volunteer work. This New Horizons program for seniors then exists for that reason, to assist seniors with seniors. The contribution of seniors is crucial. They provide a lot of their time and their advice, and it has a very significant impact on other seniors in their community. It is a very good program, and I'd like to point out to the committee once again that there is an opportunity for the committee to give some thought to the way in which this program might be changed and improved, because this is something that will be of interest to us over the next several years. We may decide to redraft the parameters of the program, and I think that your point of view on this issue will be of use to us. As a Quebec member of Parliament from Laval, I'd like you to tell us something about the bilateral agreement between the province and the federal government of over $400 million aimed at facilitating access for Quebecers to affordable social housing, something that was announced in Laval last January. I'd like to know what the impact will be for Laval and for Quebec, and I suppose that this is one of several announcements that will be made throughout the country in respect to facilitating access of our fellow citizens, particularly seniors, to affordable housing and social housing. Thank you again. Housing, as we said, is one of the central elements of wellness for our senior population, particularly those who are vulnerable. It's a central element, as I said, because it makes it possible for seniors to live at home and obtain the services they require at home. This national strategy that we are developing at the present time will be developed over the next 11 years. It will have a transformative effect on living conditions of our more vulnerable citizens, more particularly seniors. Because of these investments and our cooperation with the provincial partners and the territories and municipalities, social affairs and so forth, we will be reducing by half the number of families that are now living in unacceptable housing conditions or are paying too much. That is, in case of seniors, who 30% of whom live in unacceptable conditions. This rate will be reduced by approximately half, from 30% to 15%, as a result of the major measures taken by the Canadian government. In addition to this, we'll also be working with other levels of government, the municipalities, the provinces and territories, Aboriginal people, and the private sector to decrease by the number of seniors living in unacceptable conditions.
Thank you, Mr. Chair. Thank you, Minister. Thanks for coming today. And thank you for coming to Brampton for announcing funding towards the national strategy, housing strategy. I, being a senior there, I come across many seniors, those who are in need of the support. Regarding, you can say, housing is a big problem for them. They have to decide between their medication and housing, where to pay more, which side to pay less. So that's a big problem for them. And now they deserve care and they deserve love. They want that they should be getting in-house nurses coming them to supporting for their medication. So my question to you, Minister Duclos, is that please fully elaborate for the committee to precisely how we can ensure all our seniors are able to live dignified life.
Good. Thank you, Ramesh. Again, a great pleasure and privilege to be with you and to commend you on your own efforts. I've seen you in your riding. I've seen how committed you were to making your families and your community better. As we all know, for seniors, the most important dimensions of their well-being revolve around feeling safe, being safe, having access to affordable housing, having access to appropriate healthcare services, being able to participate in their community. And all of these are key elements by which our government can make a difference. So, as we've mentioned earlier, the housing investments that we're going to make over the next 11 years will transform the lives of hundreds of thousands of seniors. We've already started to do this since Budget 2016. We hope to pursue that for a much longer time period. For healthcare, as we know, provinces and territories share fully our ambition to make home care, home care, mental care a key priority. So we're working with them very closely on pharmaceuticals. Now we know that the price of medicines is often a severe concern for seniors who have to choose between buying their medicines or feeding themselves or housing themselves appropriately. And finally, as I said earlier, also the type of infrastructure in which, to which they have access, transport infrastructure, public transit, the healthy environment, clean air, access to quality water. All of that is also very key in the welfare of our seniors, and these are important dimensions of what infrastructure investments will be making in the next 11 years.
Thank you. Thank you, Minister. And now over to MP Rumi, please.
Thank you very much. And thank you, Minister, for being here today. So it's almost 2 years as a new MP, and coming into this, we've heard testimony from our poverty reduction study. We heard from quite a few witnesses. The challenges not only for seniors, but for low income, for youth, about the lack of housing, lack of affordable housing, lack of rental housing. And what's become painfully clear to me, this is not something that has happened over the last year. It's not something that's happened over the last 2 years. This has been years of neglect, of nobody paying attention to the housing for our seniors. So what I'd like you to expand on is if you can tell us more about the $11 billion over the next 10 years for housing, and how is that going to impact our seniors, and what's the long-term picture? Where does that really put us over the next few years?
Thank you, Dan, for the hard work and for your interest in the topic. Again, we understand how important, and we is inclusive of everyone around this table, I'm sure, we understand how important housing is as a key, as a cornerstone of the lives of families, as well as a pillar of the lives of sustainable and inclusive communities. And that's why the disengagement of the federal government over the last 20 years. It's not a matter of one government, it's a matter of several governments. In the last 20 years, the federal government has been neglecting its responsibility when it comes to providing the quality and affordable housing that our more vulnerable Canadians need and deserve. So we are changing this because we believe that we can't go on ignoring the housing needs of our families and communities. So we are also mindful of the fact that this re-engagement of federal leadership needs to be sustained over the long term. Our partners want a long-term vision, want a long-term commitment. That's why the 11-year agenda is such an appreciated and valued engagement on the part of the government. And working with partners, other governments and the private and social sector, and insist on the social sector because they are there. They want to support us in leveraging their human and financial resources. That's why partnering with them will be able to make a huge difference in the lives of so many Canadians over the next 11 years. And just again, to give you an example, we project that about half of our of Canadians currently renting a home, half of those will be taken out of the conditions in which they live now, which are conditions of inadequate or unaffordable housing. The same thing for homelessness will have a big impact on the number of chronic or episodic homeless Canadians. We predict, with the amount of investments we'll be making over the next 11 years, we predict that about 50,000 Canadians per year will either be prevented from entering into homelessness or will be lifted out of homelessness in each of the next 11 years. So that's a very significant impact on the lives of the most desperate Canadians of all. To live without a home is almost certainly the worst living condition in which a Canadian can find himself or herself. So that's going to be tremendous for these Canadians and tremendous for our society as a whole.
Certainly, when I meet with seniors in my riding of Pitt Meadows, Maple Ridge, the challenges that I see, especially with senior men, single men, that they're not ready to go to a home, but they have nowhere else to go. Indeed, some of them end up at the local Salvation Army. And what I see is their spirits are crushed because they're not ready to be in there. And do you see, a lot of times people look at the federal government and say, you fix this. Do you see this as a one government fix the whole problem, or do you see it more as how do you see other municipal, provincial, private? Where do you see that playing out?
What we hear from Canadians and from Canadian organizations and stakeholders is great. No, they are saying, we've been waiting for you for a long time. No, we've been very patient, but we're there. We're there. We're ready to support you financially and with our human resources. We need your presence, however. We need the government to establish its leadership through resources, and we know what these resources will be because of last March budget, but even more importantly, with mechanisms by which they will be able to partner with us. So that's why it is so key to not only renew the leadership, but also to renew the mechanisms through which the housing investments will make a big impact in our communities. There will be details announced in the next few months on how we will work with provinces, territories, municipalities, the private and the social sectors, details around how we will leverage, again, the tremendous human and financial resources that partners outside of the federal government have been waiting for so long to invest in addressing the housing needs of Canadians.
Thank you very much, Minister. Now over to MP Vecchio, please.
Thank you very much, Minister, for joining us today. And today I'm going to ask you to take off your minister hat and put on your economist hat, because I have had the opportunity to watch you speak as an economist, and I know the great job that you do there. So I want to start off with the old age security, and you had indicated why you had gone into politics and why you had done a study on the old age security is because of the change of the rate from 65 to 67 and reducing it back down to 65. Now, other countries such as the U.S., the Netherlands, Germany, Belgium, a variety of other countries have adopted the policy to increase the age to 67. And I want you to speculate it if you don't mind, because we recognize the workforce is going to change drastically in the next 15 to 18 years, where we're going to see the number of workers to seniors decrease quite a bit. Do you believe it is necessary for the government, in turn, to study the changes to old age security in the future? Do you think that might be something that might be a necessary step in the future as our demographics change?
Thank you, Karen. And as you've indicated, I've had the fortune and the pleasure of getting to know you better in other environments, such as in Latin America not so long ago, but I should not perhaps speak about this in public. But I won't mention the gifts you gave me either, which were very sweet, I would however mention. Now, this being said, the question is totally appropriate. However, it rests on a source of confusion, which I would like to address at the very start. The 65 years old is the age of eligibility. It's not the age of retirement. Now, no one forces anyone in Canada to retire at a particular age. The age of retirement is a personal decision made by families and individuals on the basis of their health, of their family circumstances, on their ability to retrain if they have lost their job, on their ability to continue their job in the labor force. So the age of retirement is a personal decision. The age of eligibility says that if needed, at 65 years old, Canadians can have access to a retirement pension which will prevent them from living in adverse and severe poverty.
Thank you very much. So maybe elongating that time where somebody, and I know there was the idea of adopting into it later. You know, CPP, I believe, has that, where that if you're taking it if you're taking it at a later age, then you are paid a little bit more. So maybe that's something we can look at for old age security. But now I'm going to turn the dial a little bit here. And yes, I know that we both have this love for chocolate, Minister Duclos, so I may have to give you a chocolate bar after this. But let's start talking about the increased costs to seniors. We recognize that there's going to be more taxes on seniors. There's going to be more taxes on Canadian, and specifically, I want to look at seniors. When there are going to be taxes on necessities, what is the federal government going to do about this? Necessity to me is heating, hydro, gasoline, things of that, which we recognize that the carbon pricing is going to have an impact on this. So when we know here in the province of Ontario, for instance, we have all seen our energy bills skyrocket. My mother and father happen to be here today, so I know their taxes, I know their costs of doing the electricity and gasoline have increased substantially. And we know that there's also a 4% charge that is mysteriously hidden in the delivery charge of the Ontario government that is part of their cap and trade work. So I'm asking you, what is it that we're going to do for seniors, and how is the carbon pricing going to impact our most vulnerable seniors?
Thank you, Karen. So your parents are somewhere, so congratulations to your parents for having had the fortune of raising a daughter that has now come to the House of Commons. Now, the carbon pricing discussion. Now, there are three objectives in that agenda. The first objective is to protect our environment and the health of our families. Clean air, clean environment are key elements of not only the welfare of all Canadians, but certainly the welfare of seniors. And the seniors also care about that because they care about the welfare of their children and their grandchildren. The second element in that agenda is to position Canada as a leader in economic development and innovation.
Minister Duclos, I hate, because I know we only have a few more seconds. And so I'm going to say, I recognize what's important for our environment. I totally understand that, and we have different ideas of what we may do that. But the concern that I have is that we know that the government does have this information. You as an economist, I know would think that the information is also very necessary. You've said with the old age security, it was necessary to look into what the poverty was going to be for our seniors. So I have faith in yourself and part of this government to actually do the dedicated work that is necessary for seniors so that we actually know what the negative impact on our senior population is going to be because of the increases of this environmental policy. So if we could just kind of stick to that part. I just want to know that, because there is data that our government has requested that we do not have, and I want to be sure that that information gets out there so that we can provide for our most vulnerable seniors that are going to be impacted by this negative pricing.
And the data,
very short time.
And the data will show that if provinces and territories use the resources that carbon pricing will give them, they can do what we've done in the last 18 months, which is to lift a large number of Canadians, including Canadian seniors, out of poverty by reinvesting those resources in helping the more vulnerable Canadians. We've shown how to do this in the last 18 months. I would expect that provinces and territories in many cases will be inspired by that and do the same thing.
Thank you very much, and unfortunately, that is time today. I want to take the opportunity to speak on behalf of this committee to thank Minister Duclos for appearing here today, and we are very excited to be embarking on this study, and we all agree that this is something that we. As parliamentarians are obligated to ensure that we have a plan and a path forward for seniors. So thank you all very much. Thank you to the folks to my left and right and behind me for making sure today went smoothly. And I hope that that Karen's parents have a fantastic visit here in Parliament. Thank you.